A lot of times, some of these people don't have any ability to afford care, can't qualify for it, or don't qualify for Medicaid or any other public health services systems.
We went to one town which is close to where I live, which I always assumed was like this high-class town. When I was growing up, it was like, oh, you come from such and such a town, wow. We saw about 200 people that had no health services. They had a lot of migrant people that had come in that weren't able to get hooked up with primary care physicians because there were so few spots that people could get appointments. There are so many areas in the United States that people don't have the health care that they need.
Here, does not matter. You come in, say what you need help with, no insurance, no payment, no ID, and just say what needs to be helped.
Well, I'm only in the I section, but hopefully we discover any kind of serious problems they have and we get them optimally functioning so that they can be successful. We have discovered some pretty interesting and even sight-threatening conditions, and discovering them in time, you can get treatment. If you wait until it's too late, it is too late.
So obviously when you hear that it's a free resource, you never know exactly what to expect.
Okay, there's got to be a catch here, but it is all free.
And I have been amazed at how awesome it's been. They see people both as a human being as well as a patient, and the medical service that has been provided has been better than services that I've paid for in the past. It's been 4 years since I was able to go to a doctor, get seen for any medical care. Also learning all of the information about the medical care providers that we have that work on sliding fee scales for people that are more in my situation where we can't quite fit medical expenses into the daily budget or don't have affordable or available insurance.
You really need to come and see it. It's hard to truly understand that we are truly free medical, dental, and vision care. I didn't truly believe it when I had heard about RAM. That's why I came as a volunteer. It seemed too good to be true, right? I wanted to see if it was true. And I would just recommend just coming out, even if it's just for a tour. Let's say you can't dedicate your whole day, just coming out and checking us out. I would highly recommend you just dedicate whatever time you can.
Before becoming an optometrist, I actually was homeless for a length of time myself. And I know for certain that not many clinicians can say that with certainty. But being able to run this type of event, I'm able to see a lot of these people who I've been in those particular situations, and a lot of these people don't really know where to go or how to start or even how to even trust the system. And here, I don't want there to be any kind of system to which they have to be burnished trust on. So I always love learning that there is this community who otherwise won't enter the house unless the door's already open. And that's what this clinic's about.